Chest pain, the moment somebody feels it, they think heart attack. Your ECG, echocardiogram, even angiogram, all might be normal, but the pain keeps coming back. 8 out of 10 people who go to the hospitals with chest pains don't have any heart issues. In this video, I will explain why gas and digestive problems can cause chest pain exactly similar to the heart, how you can identify it safely, what can you do about it, and can you tell the difference whether the pain is coming from the heart or from your stomach. This video can help you get rid of a lot of anxiety about chest pains. Please subscribe to this educational channel for digestive health videos. Chest pain is one of the common reasons why people go to the hospitals. So before I get into what causes the chest pains as a gastroenterologist, I want to ensure that any new or severe chest pain that is persisting, you should never ignore. You should always get it checked for the heart, at least a basic ECG in a nearby hospital, especially for those people who might already be having risk factors like having diabetes, sugar, BP, cholesterol, family history of heart problems, smoking. These kind of patients I see often, they've already gone through a cardiologist, they've been told that there is nothing wrong with their heart, so then they come to see us. So now they don't know what to do next, where is the pain coming from, they are not sure as to where to go, and this kind of people end up with gastroenterologists. That's because 8 out of 10 people who go to the hospitals with chest pains, pain is not related to their heart. Common cause of such pains is esophageal, gastric issues. Firstly, acid reflux or gastroesophageal reflux. So the stomach acid starts to come back into the food pipe. That is the number one cause of what we call as a non-cardiac chest pains, which means the pain is not related to your heart, but you keep on getting it. The acid that comes into the food pipe, the esophagus, starts to cause irritation. Esophagus is right next to your heart, so the pain can be burning. You can feel tightness in the chest. Sometimes it can be a radiating pain that can go to the neck, that can go to the jaw, even the arm. That's because of the common nerve fibers. This pain can sometimes feel exactly like your heart pain. Secondly, gas and gastric distension. So excess of gas in the stomach, in your intestine. If you have a lot of this bloating, it pushes the diaphragm against and the chest wall. So this can bring on the pain that might increase, especially after you have eaten a heavy meal, after having eaten very greasy, oily, fried foods, or after having taken carbonated drinks like cola, sodas, or you've eaten too fast and gulped a lot of air. That can also give you that heaviness and bloated, or you may have just overeaten. Sometimes just burping, belching that air can immediately give you the relief, or passing from gas below can give you the relief. So if it gives you relief like that, you know it's not from the heart. The third problem is people get cramps like spasms in the food pipe. So the esophagus can go suddenly into intense contraction that can give that squeezing chest pain. It can last very briefly for sometimes even minutes. Stress, anxiety, acidity, taking hot drinks can all trigger it. If you feel anxious, worked up, you can get sometimes chest wall muscle spasms. So the muscles between the intercostal ribs, the ribs, you can feel there is a very sharp pricking pain that comes and goes. So sometimes it's a very sharp pain that just lasts for a few seconds, or if you feel that the pain is just localized, you can put your finger and say that I feel tender here, I feel there is a pain that is not heart. That could be musculoskeletal pain, especially if we feel it's a bit sore to touch. It can be just sometimes a muscle strain, so it's a musculoskeletal pain. Common issue that as a gastroenterologist I see is gastritis, stomach ulcers. So irritation of the stomach lining can also cause pain because the stomach is quite high up. A lot of people mistake all of this abdomen for stomach. So this stomach, the gastric part, is quite high up, so the pain can be felt quite high. So any kind of chronic irritation in the stomach lining, inflammation, gastric ulcers, this can all cause discomfort and pain that can be felt in the lower chest, especially after having taken any alcohol or painkillers that may have been causing irritation to the stomach lining, or you might be on aspirin that you may have been taking it for the heart. If you get repeatedly stressed, that can also increase the acidity levels. You may have H. pylori, the stomach bacteria, that can also cause irritation. So this kind of stuff can bring on the discomfort and pain. Other thing sometimes people get mistaken is stones in the gallbladder. This is right below the rib cage, tucked under the liver. Sometimes the pain is quite high up in the center. It can go through to the back or between the shoulder blades. Sometimes the pain can be confused for heart attack because the pain is so intense in the upper abdomen. Very intense pain that can last half an hour, it can up to 2 hours. Sometimes you're violently throwing up this yellow bile. So that's a typical gallbladder pain. Important thing is nobody wants to take chance from a heart attack. So how can we differentiate whether the pain is from the heart or whether it's a gastric pain? There are some important clues that I will give you, but if you're in doubt, this is not from the heart, or if you got any kind of doubt in your mind, could this be heart, you need to get an ECG done, because heart attacks kill people, whereas gastric discomfort is not going to be life-threatening. Pain from the heart comes quite often on exertion. Let us say when you're walking uphill, when you're going up and down the stairs, when you're exercising, so when your heart rate is going up, so that's when you start to get the pain. When you relax, when you rest, the pain starts easing off. So that is very typical heart-related pain. Or if the pain is associated with a lot of sweating, if you're getting out of breath, pain is constantly going to the left arm, it's getting more and more tight in the chest, it's very diffuse, and it's building on more and more. So this has got nothing to do with what you have eaten. So this might be very suggestive of heart-related pain. Sometimes even with the heart, you can get burning sensation. So burning doesn't mean that it's always from the food pipe. So the burning sensation that gets intense, that doesn't get relieved by drinking milk, drinking water, or any antacid syrup. So that burning sensation right behind the breastbone in the center, if it is increasing in intensity, you should not ignore. The common scenarios where pain can be gastric origin is pain that's usually coming on after eating very heavy food, like let's say biryani, something very rich. Or if you have a burning sensation in the center, in the upper abdomen, you have a glass of buttermilk, a glass of water, some antacid syrup, it gives you fantastic relief, you feel absolutely fine, then we know that it's not heart. When you burp, or if you feel fine when you walk around, the pain is gone, that is gastric origin, because you're getting rid of the air that is trapped in the food pipe in the stomach, or passing a gas that is trapped in the intestine from below. So if you're getting quick relief from taking antacid syrups, simple home remedies, it goes completely, then it's more of a gastric origin. If it is very sharp pain, just lasting for a few seconds here and there, then it's unlikely to be the heart. The pain, if it is mostly when you lie down, when you get up and walk around, if you start to feel better, that's more of a gastric acidity reflux type of pain. So there are these kind of differentiators of whether it is from the heart or from the gastric. Indian lifestyle plays a major role in triggering these pains. Common problems are eating late in the night, eating very heavy, spicy, greasy foods, especially late in the night, having tea, coffee on empty stomach that can cause irritation to the food pipe and the stomach, long gaps between the meals, no proper fixed timing of the meal. So all of this can increase the bloating, the gas, the acidity, constant stress, poor sleep also increases the acidity and worsen even the anxiety. Frequent painkillers can cause damage to the stomach lining. It can cause irritation to the food pipe. So stress, anxiety, depression, unwanted thoughts, worries can all trigger these issues because the gut and brain are directly connected. Stress itself can bring on this kind of gastric type chest pain by what we call as the spasms in the chest. So what can one do to minimize this gastric pain? The first thing is to have smaller meals. So try and avoid eating large meals, especially dinner. Always go for a lighter meal for dinner. Try and have your last meal of the day 2 to 3 hours before you go to bed, preferably by 8:30 at the latest. Try and cut down in general on oily, very spicy foods. Even for those people who have an afternoon nap, try and avoid lying flat after your meal. If you want to have a nap in the afternoon, lie down on a reclining chair so you're not lying flat, increasing the reflux. Cut out on any carbonated drinks, all these colas. If you are a smoker, you need to quit because it's a risk factor for both heart disease as well as the gastric pains. Alcohol, for those who are consuming on a regular basis, you need to keep it to very occasional because alcohol can also trigger acidity. It can worsen the irritation in the esophagus, in the stomach, and bring on these gastric pains as well. Most importantly, physical activity. Movement helps improve a lot of gastric symptoms as well as helps your mental health. If you have stress, anxiety, sleep, by having regular physical activity, it can improve all of this. So thereby, it has got that positive effect on reducing the acidity, the bloating, the gas, the gastric chest pains. So my final advice is, if your pain is very severe, if you are in doubt, or if you never had chest pain before, it is for the first time, it's always better to go and find nearest clinic, nearest hospital, get at least a basic ECG done. If the pain is going on for months or a couple of years, that won't be to do with the heart. Chest pain, of course, is frightening, but as I mentioned, most people's chest pains has got nothing to do with their heart. Digestive disorders are common causes and treatable, but having the right diagnosis, it removes fear, because it's not a nice thing for anybody to be having chest pains, especially in the night when they start to panic. You don't know what to do, whether to go to the hospital or not to go. Nobody, of course, wants to take chance and risk heart attack. This is one of the common issues that I see in my gastroenterology practice, which is why I thought it is very important to address in this video and clear some of the doubts and fear for some people who frequently present with this, what we call as non-cardiac chest pains. So that is gastric type of pains. Please do subscribe to this educational channel for more videos from Bangalore Gastro Center hospitals that is backed by science. Thank you very much.